Hello, everyone. I'm just going to talk about a career in nuclear medicine and why you should consider it. I'm an ST7 nuclear medicine registrar at the Royal Free Hospital in London. I'm also the trainee representative for BNMS and the National Nuclear Medicine Teaching Program Coordinator. My email address is there, so if you have any doubts or if you want to get in touch with me, please feel free to drop me an email. Um, with this presentation, I aim to kind of show you what the nuclear medicine career pathway is and why you should consider it. So let's get going. I don't have any declarations, and I have no financial interests or relationships to disclose. So, what is nuclear medicine? Nuclear medicine uses radioisotopes to visualize physiological processes in the body. So, the way I explain it to everyone is that this is radiation that is emitted from the body, and we use imaging modalities to kind of detect this radiation as opposed to radiation that we give externally with an X ray. And we do use a combination of radiological imaging, such as CT and MRI, in nuclear medicine to make it hybrid imaging. And we can also use radioisotopes to treat patients. So let's see a bit more about it. What kind of imaging do we do? There are a range of general nuclear medicine studies that you might have already come across in your foundation years or co-training. These include ventilation perfusion scan, or commonly called the VQ scan. We do renograms or MAC3s, DMSAs, system cardiac scans, and plain bone scans. But apart from this, there are a range of hybrid studies, including a PET CT and a SPECT CT. Um, and you might have heard a term called interventional nuclear medicine or nuclear medicine to administer therapies. So yes, we do administer a lot of therapies. This include radioiodine ablation for thyroid cancer, radiosynovectomies for particularly for patients with severe rheumatoid arthritis or synovitis from any cause. We also give peptide receptor therapy for neuroendocrine tumors, selective internal radiation therapy for liver tumors, bone metastases, and the new kid on the block is lutetium PSMA therapy for prostate cancer. Why should you consider training in nuclear medicine? It is one of the constantly growing specialties. There are always new traces, new therapies, and new developments. It's very technologically savvy. Most of my day is spent sitting in front of a computer, either reporting or doing other activities. So if you have an interest in that, then definitely consider it. The other biggest advantage I feel is it allows you to train both as a radiologist and as a nuclear medicine physician. You are problem solving and diagnosing a range of various specialities, and various imaging modalities are used in the specialty. And you have an option to do a range of activities which involve both patient contact, but also without patient contact. And one of the other biggest things is it allows you to administer personalized medicine because you can target the areas that are affected pathologically by administering therapies. It has the potential to work with a big team. There's a huge research opportunity. And the biggest advantage, which should not be ignored, is that it allows you to have a very good work-life balance. So what is the training pathway? This scheme kind of shows the pathway. After your foundation years, you would get into core training years. It could involve any of the core training, including medicine, acute care, common STEM, pediatrics, or core surgical training. You would have to pass the relevant exams, and then you would be selected onto the 6-year nuclear medicine program, which allows you to gain dual CCT in both nuclear medicine and radiology. And on the way, you would give the radiology exams, and you would also do a diploma in nuclear medicine. So what are the entry requirements? Like I said, in order to apply to ST3 nuclear medicine, you would have to do any of these core trainings and pass the relevant exams. Um, how long is the training time? It's a 6-year training program. For the first 3 years, your training is mainly concentrated in radiology. So you spend 80% of the time in radiology and 20% in nuclear medicine. And for the next 3 years, you switch. You spend 80% time in nuclear medicine. You would have to complete full fellowship of the Royal College of the Radiologists, that is, give all the relevant exams and pass them in the first 3-4 years. And then you would also end up doing a diploma in nuclear medicine, which you can extend it to do an MSc. Radiology on calls, it will depend on the site where you're training, because there are certain sites which do not have night on calls and so on. So it would depend on which training program you get into. What do I love about my training? Well, the biggest thing that I've noticed, having come from a background of training and co-medical training, is that all my reports are checked and all my scans are reviewed, whether I get one-to-one feedback at the same time, or sometimes if it's reviewed at a later date, you can always go back to see what the consultant has thought about your scan, and you can learn based on the changes that they have made. So there is always feedback at all times, even though it may not be verbal at all times. There's always opportunity to constantly learn. There's most of the training programs that I know of, both in radiology and nuclear medicine, involve great in-house teaching, but also there's great national teaching. So you are constantly learning. The other biggest advantage is you report a range of specialties from head to toe, so pediatrics, neurology, renal, ortho, gynecology, and most nuclear medicine training is based at major tertiary care centers, so you have the opportunities to see a wide range of pathology. Nuclear medicine is a relatively small specialty, so you kind of get to know almost everyone, which is good. So what is the typical day in a trainee's life, but also as a consultant? Well, the biggest advantage is there are no emergencies in nuclear medicine, so great opportunity for work-life balance. You can do a lot of reporting from home. There are lots of jobs because it's a very small specialty. And a typical day would be split into reporting general nuclear medicine or hybrid imaging, PET-CT, MDTs. But also, depending on where you're working, you may spend your time, and depending on your job plan and depending on what you select, you may spend your time giving therapies, doing some clinics such as thyroid clinics, covering stressing lists, that is myocardial perfusion imaging stressing. And also there are lots of opportunities for research and teaching. You can also divide your job role into nuclear medicine and radiology commitments as you wish. There are certain consultants who do half radiology, half nuclear medicine. There are certain others who do exclusively nuclear medicine. It is completely based on your choice, what you end up doing as a consultant. So for more information, please feel free to visit the JRCPTB website, British Nuclear Medicine Society website, and there are certain very good articles and videos on the Royal College of Physicians Specialty Spotlight website. And I would highly encourage you to arrange a taste day and taste a week in your local hospital to get more information about the specialty. So thank you for listening, and I hope I've convinced you to at least consider a career in nuclear medicine, and perhaps you can decide more when you see one of us on your taster day or taster week. Thank you. Bye.